Think about it. What if you had to choose between feeding your family or seeking proper medical care for them during their pregnancy? Can you fathom the anguish of losing a child to a preventable disease because timely vaccine doses were not given? These questions may seem distant to some, but for millions of mothers like Savitri in rural India, they are harsh realities. Pooja, eldest daughter of Savitri, who is a mother of three, resides in a rural region called Shabad, located just 10 minutes away from our university, and is home to a population of over 66,000 individuals, majorly involved in industrial work and labor. It is identified as one of the areas consisting of numerous slums where access to healthcare is scarce. Shabad Maternity Home, a public health center, is the only healthcare facility for a region consisting of 66,000 people. To put into perspective, this is what such a number looks like at a stadium. However, with only 4 doctors available for a sleek 5-hour window per day, the healthcare situation only worsens. But Savitri is not alone. There are millions of mothers living in rural India who are deprived of basic healthcare facilities. And according to a study by the World Health Organization, only 30% of rural households have access to basic health facilities. Studies by the NIH also show that a very high infant mortality rate of 81.3 per 1,000 live births were observed. The same study highlighted that 72.05% of newborns develop minor to major complications within 6 weeks of delivery. And it's not the mothers who are at fault. Women in rural India often face problems like malnutrition due to poverty, early marriage and teen pregnancies, lack of awareness and education, cultural beliefs and traditional practices, and the lack of access to clean water and sanitation, which vastly affect their maternal period. It's not just about statistical data, but to give every mother an opportunity for basic healthcare facility, because there are 2 lives at stake instead of 1. Pooja's mother was being frequently visited at home by a woman of the same age as Savitri, who despite her family's challenges, ensured she attended regular checkups. Intrigued by this, we delved deeper into the role she plays, which ultimately led us to the maternity center to learn more. While at the maternity center, we discovered numerous other women like the one visiting Savitri, who spend their working hours sitting outside the ward, filling endless paperwork. Upon talking to one such worker, she identified herself as an accredited social healthcare activist or Asha worker. Asha workers, despite facing numerous hurdles, are the unsung backbone of the rural healthcare system and act as a bridge between the community and the public health services. Let's hear directly from them.
करती है जो कि गर्भवती महिलाओं का ध्यान रखती है, बच्चों को टीका लगवाती है और जो कुपोषित बच्चे हैं उनको आंगनबाड़ी तक पहुंचाती है, वहाँ से खाना दिलवाती है और उससे ज़्यादा कुपोषित है तो सेंटर में लाते हैं और यहाँ से डॉक्टर जो दवाइयाँ वगैरह देते हैं।
एक अगर एवरेज दिन की आपकी बात करें वो कैसा होता है?
बेकार हालत खराब है।
पेशेंट कहीं भी भेजेंगे, हर जगह पेशेंट भी परेशान, हम भी परेशान।
यहाँ से
पेशेंट हमें सुनाता है।
तक ले लो।
आपकी सैलरी की बात करें वो
सैलरी 3,000 सैलरी 3,000 सैलरी हमें मिलती है। इसमें हम पॉइंट रखते हैं 6 पॉइंट। अगर हमारा एक भी पॉइंट कट गया ना तो हमें 500 रुपये देते हैं।
However, the job of an Asha worker is not easy. They face humiliation, rejection, and are heavily underpaid. With each Asha worker allocated around 400 homes, comprising over 1,700 to 2,000 people, their workload is overwhelming. Namaste. We are Team Praan from Delhi Technological University, and our problem statement is, how might we sustainably empower Asha workers for efficient rural perinatal care, fostering patient awareness and expanding healthcare access for those currently underserved by the healthcare system. Pooja is heavily inspired by the Asha worker and wishes to be like her. Demotivated by the current scenario, Team Praan is deeply committed to ensure that 1 million of Asha workers working today and for children like Pooja who are upcoming Asha workers get an easy and hassle-free life free from systematic challenges.